Let's be honest. The word shock on your NCLEX exam can feel like a red alert. Your heart races. Your palms sweat. You stare at the options, thinking, is this septic? Neurogenic? Wait, what's the priority again? You're not alone. Thousands of nursing students freeze when shock scenarios pop up. Not because they haven't studied, but because NCLEX doesn't test memory. It tests judgment. But here's the good news. In the next few minutes, I'm going to break down the shock nursing, show you exactly how to spot them under pressure, and teach you which move to make first, every time, if you're serious about passing NCLEX 2025 on your first try. This is a video you cannot skip.
Question 1. What is the priority goal in the initial treatment of hypovolemic shock? A. Restore circulating blood volume. B. Reduce inflammation. C. Prevent infection. D. Lower heart rate. Answer. A. Restore circulating blood volume. Question 2. Which clinical finding would the nurse expect in the early stages of shock? A. Tachycardia. B. Hypothermia. C. Hypoglycemia. D. Cyanosis. Answer. A. Tachycardia. Question 3. What is the main mechanism causing hypotension in anaphylactic shock? A. Vasodilation due to histamine release. B. Decreased cardiac contractility. C. Increased blood viscosity. D. Hemorrhage from capillaries. Answer. A. Vasodilation due to histamine release. Question 4. Which sign indicates fluid resuscitation is effective in shock management? A. Improved level of consciousness. B. Persistent hypotension. C. Cold extremities. D. Elevated lactic acid level. Answer. A. Improved level of consciousness. Question 5. Which organ system is typically affected first by inadequate perfusion during shock? A. Renal system. B. Endocrine system. C. Musculoskeletal system. D. Integumentary system. Answer. A. Renal system. Question 6. What is the purpose of giving vasopressors to a patient in distributive shock? A. Increase systemic vascular resistance. B. Lower cardiac preload. C. Increase urine output. D. Correct blood glucose levels. Answer. A. Increase systemic vascular resistance. Question 7. A nurse is caring for a patient with shock. Which finding requires immediate intervention? A. Oxygen saturation of 88%. B. Respiratory rate of 24. C. Heart rate of 92. D. Capillary refill of 2 seconds. Answer. A. Oxygen saturation of 88%. Question 8. Which shock type is most likely to occur following spinal cord injury? A. Neurogenic shock. B. Cardiogenic shock. C. Septic shock. D. Hypovolemic shock. Answer. A. Neurogenic shock. Question 9. Which patient is at greatest risk for developing septic shock? A. An immunocompromised patient with a urinary tract infection. B. A healthy young adult with a sprained ankle. C. An elderly client taking aspirin daily. D. A teenager with seasonal allergies. Answer. A. An immunocompromised patient with a urinary tract infection. Question 10. Which 4 fluid is preferred in the first hour of treating septic shock? A. Normal saline. B. Half normal saline. C. Dextrose 5% in water. D. Albumin solution. Answer. A. Normal saline. Question 11. A patient in cardiogenic shock is receiving morphine. What is the expected effect? A. Decreased preload and afterload. B. Increased heart rate and cardiac output. C. Increased respiratory rate. D. Stimulated renal perfusion. Answer. A. Decreased preload and afterload. Question 12. In shock, why is urine output a critical parameter to monitor? A. It reflects renal perfusion. B. It confirms cardiac rhythm. C. It determines respiratory status. D. It predicts electrolyte levels. Answer. A. It reflects renal perfusion. Question 13. What should the nurse do immediately if a patient in shock becomes unresponsive and pulseless? A. Start cardiopulmonary resuscitation. B. Elevate the legs. C. Notify the provider. D. Administer furosemide. Answer. A. Start cardiopulmonary resuscitation. Question 14. In a patient with obstructive shock, which condition is an emergency cause? A. Cardiac tamponade. B. Hyperkalemia. C. Diabetic ketoacidosis. D. Atrial fibrillation. Answer. A. Cardiac tamponade. Question 15. Which lab value would support a diagnosis of early septic shock? A. Elevated white blood cell count. B. Decreased serum sodium. C. High platelet count. D. Low creatinine. Answer. A. Elevated white blood cell count. Question 16. A nurse suspects neurogenic shock. Which finding supports this suspicion? A. Bradycardia with hypotension. B. Tachycardia with cyanosis. C. Fever with chills. D. Bounding pulse and edema. Answer. A. Bradycardia with hypotension. Question 17. What is a priority nursing intervention for a patient in early hypovolemic shock? A. Insert a large bore 4 catheter. B. Apply cooling measures. C. Administer antihistamines. D. Place the patient in high Fowler's position. Answer. A. Insert a large bore 4 catheter. Question 18. Which condition causes reduced preload in hypovolemic shock? A. Loss of circulating blood volume. B. Decreased systemic vascular resistance. C. Increased afterload. D. Elevated contractility. Answer. A. Loss of circulating blood volume. Question 19. A patient with septic shock has bounding pulses and warm skin. What does this indicate? A. Early distributive phase. B. Refractory phase. C. Compensated cardiogenic shock. D. Recovery from shock. Answer. A. Early distributive phase. Question 20. What action is most important before starting vasopressor therapy in a shock patient? A. Ensure adequate fluid resuscitation. B. Administer antihypertensives. C. Check blood glucose. D. Reduce oxygen flow rate. Answer. A. Ensure adequate fluid resuscitation. Question 21. A patient with anaphylactic shock develops stridor and facial swelling. What is the nurse's priority? A. Administer intramuscular epinephrine. B. Start in 4-line for fluids. C. Elevate the head of the bed. D. Apply oxygen via nasal cannula. Answer. A. Administer intramuscular epinephrine. Question 22. What clinical finding suggests cardiogenic shock rather than hypovolemic shock? A. Crackles in the lungs. B. Dry mucous membranes. C. Decreased central venous pressure. D. Increased capillary refill time. Answer. A. Crackles in the lungs. Question 23. In distributive shock, which change is most responsible for the drop in blood pressure? A. Widespread vasodilation. B. Decreased heart rate. C. Loss of blood volume. D. Obstruction of blood flow. Answer. A. Widespread vasodilation. Question 24. What is the nurse's first priority for a patient with suspected tension pneumothorax and obstructive shock? A. Notify the healthcare provider for immediate decompression. B. Prepare for pericardiocentesis. C. Start dopamine infusion. D. Insert a urinary catheter. Answer: A. Notify the healthcare provider for immediate decompression. Question 25. Which laboratory result is most concerning in a patient with septic shock? A. Elevated serum lactate. B. Low blood urea nitrogen. C. Normal white blood cell count. D. Elevated platelet count. Answer: A. Elevated serum lactate. Question 26. A patient in shock is oliguric. What does this indicate about renal perfusion? A. It is decreased. B. It is normal. C. It is increased. D. It is unaffected. Answer: A. It is decreased. Question 27. What finding in a shock patient requires the nurse's immediate action? A. Decreased level of consciousness. B. Blood pressure of 110/70. C. Heart rate of 88. D. Capillary refill of 2 seconds. Answer: A. Decreased level of consciousness. Question 28. What is the best indicator that fluid resuscitation in a shock patient has been successful? A. Urine output of over 30 ml per hour. B. Increased white blood cell count. C. Bounding peripheral pulses. D. Cool and pale skin. Answer: A. Urine output of over 30 ml per hour. Question 29. What is the purpose of administering corticosteroids in septic shock? A. Reduce inflammation and support blood pressure. B. Promote diuresis. C. Lower potassium levels. D. Control blood glucose. Answer: A. Reduce inflammation and support blood pressure. Question 30. What sign differentiates neurogenic shock from other types? A. Bradycardia with hypotension. B. Cold and clammy skin. C. Rapid, thready pulse. D. Elevated temperature. Answer: A. Bradycardia with hypotension. Question 31. What is a nurse's priority during the resuscitation phase of shock? A. Maintaining adequate tissue perfusion. B. Educating the family on prognosis. C. Preparing the discharge plan. D. Inserting a nasogastric tube. Answer: A. Maintaining adequate tissue perfusion. Question 32. What is the major goal of administering fluids rapidly in hypovolemic shock? A. Restore intravascular volume and perfusion. B. Increase cardiac contractility. C. Prevent infection. D. Enhance urine concentration. Answer: A. Restore intravascular volume and perfusion. Question 33. Which of the following best describes the refractory stage of shock? A. Irreversible organ damage. B. Responsive to fluid therapy. C. Tachycardia and warm skin. D. Early compensation phase. Answer: A. Irreversible organ damage. Question 34. What finding suggests that cardiogenic shock is worsening despite treatment? A. Increasing pulmonary crackles. B. Decreasing jugular vein distension. C. Stable blood pressure. D. Improved level of consciousness. Answer: A. Increasing pulmonary crackles. Question 35. In neurogenic shock, what nursing intervention helps prevent venous pooling? A. Use of compression stockings. B. Frequent fluid boluses. C. Raising the head of the bed. D. Encouraging deep breathing. Answer: A. Use of compression stockings. Question 36. A patient in septic shock is receiving norepinephrine. What parameter should the nurse monitor most closely? A. Blood pressure. B. Serum sodium. C. Oxygen saturation. D. Blood glucose. Answer: A. Blood pressure. Question 37. Why does a patient in early septic shock often have flushed and warm skin? A. Peripheral vasodilation. B. Elevated cortisol levels. C. Cold diuresis. D. Increased serum calcium. Answer: A. Peripheral vasodilation. Question 38. Which condition is most likely to result in hypovolemic shock? A. Gastrointestinal bleeding. B. Spinal cord injury. C. Myocardial infarction. D. Severe allergic reaction. Answer: A. Gastrointestinal bleeding. Question 39. What is the initial management priority for a patient with trauma and suspected internal bleeding? A. Initiate large bore 4 access for fluid resuscitation. B. Prepare for discharge. C. Administer antibiotics. D. Encourage oral fluids. Answer: A. Initiate large bore 4 access for fluid resuscitation. Question 40. What is the rationale for using a central line for vasopressor administration? A. Reduces risk of extravasation. B. Delivers oxygen more effectively. C. Allows blood sampling for glucose. D. Prevents thrombocytopenia. Answer: A. Reduces risk of extravasation. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.